they're not, no source of exposure there. And then anyone who returned anywhere from mainland China in the last 14 days, or they've been in mainland China in the last 14 days, and they have some symptoms of illness, right? They have fever, respiratory symptoms, as you heard. Those folks are actually going to be referred for medical evaluation, right, at the point of entry, right, when they are screened at the airport. So they're going to get evaluated. They may be tested if that's appropriate. And just like any student with a respiratory illness, we really don't necessarily want them in school around other students until they're well, whatever the cause is. As Dr. Terashita mentioned, we're in the middle of flu season. Most respiratory illnesses are going to be flu or something else other than coronavirus here. Here in the United States, we have very, very few cases. But again, if someone's ill, it's best that they stay home and not come to school until they've been without fever for at least a day. So what about folks who have no symptoms and are traveling? So anyone who has no symptoms and has traveled from Hubei province in China within the past 14 days, those folks are sort of considered high exposure risk, and they are actually given quarantine orders at the airport by federal authorities who are screening, and they're taken to a location.
This is policy as of February 3rd.
March Air Reserve Base.
Recommendation by CDC.
So they're being taken to federal facilities, and they're being monitored and make sure they stay well. So those folks are not going to come to school if it's a school-age student. They're going to be monitored, and they'll be released when 14 days have passed if they are still symptom-free. So that's not an issue for us. So how about someone who has no symptoms, right? They're coming back from mainland China within the last 14 days, and other than Hubei province, anywhere else so Hubei, Wuhan city, and the surrounding Hubei province, of course, is where the center of the outbreak is at this point in time, where most of the cases are. So that's why that province is treated differently. But if they're from anywhere else, if they've traveled apart from anywhere else in mainland China other than Hubei, and it's before February 3rd when the new directives went into effect, and again, they're symptom-free, they don't have any restrictions because the directives hadn't gone into effect. So they're free, if they're well, they're free to return to school, and many have already. So why would we treat people differently if they traveled on February 3rd versus February 2nd? There's a reason, because there's been a big explosion of cases over just a few days around that time period. So a person who's traveling is more likely to possibly have been exposed to a case in China. Say someone who came here this week or the week before compared to 2 weeks ago, or 3 weeks ago, or 4 weeks ago. And that's why we have somewhat different directives for people who have traveled here more recently compared to people who traveled here a few weeks ago. So that's someone who's traveled here before February 3rd, right? So here's a question that I'm getting repeatedly, and I hear that the educators are getting them as well. Mom, or dad, or brother, or sister, or someone else in the house has returned from mainland China after February 3rd, has no symptoms, right? So they're fine right now. And they're practicing their social distancing. They're going to stay home for 14 days and monitor themselves, make sure they stay well. They're not going out. But can the student go to school? The student hasn't traveled, but mom or dad or someone else has traveled and is in the home now. Well, yeah, the answer is yes, because the student hasn't really come into contact with anything, right? The traveler as well. The traveler doesn't have any illness as far as we know. The student hasn't traveled. They just happen to be in the home. They're okay to go to school. So the last category is, right, the student has no symptoms, and the students return from mainland China after February 2nd, February 3rd or later, right? Does this student go to school? Well, the answer is not until 14 days have passed. Right? Until, so 14 days since they were last in mainland China. Right? So this is part of the group that we've asked to practice what we're calling social distancing, right? Stay at home, stay away from places where there are crowds. Monitor their health status, check their temperature, watch for any signs of respiratory illness. After 14 days, if they stay well, the restrictions are lifted. They can go to school, or they can go to work if they're an adult, or they can do whatever their regular activities are. So again, as it was said, the initial screening is happening at the airport, right? So the decisions do not need to be made by the schools, right? This screening and decision of what category someone is in is made directly at the point of entry by customs and public health officials or authorities who are there, okay? So DPH is not calling every school district or every school all over the county, informing them that there's a traveler who came back on a certain date and this is the instructions they received. There's a few reasons. One is a resource issue. There are many, many, many schools in Los Angeles County. There are many people returning from China. And we would not be able to do it justice to be able to call the schools. And there also are confidentiality and privacy issues, right? We have to respect everyone's privacy in terms of what their medical or health condition is. So here's the transparency. As you heard, this is an issue where things are changing rapidly. Things are changing daily, sometimes more than daily. Precautions are being put into place. The system probably has not operated perfectly. There may be travelers who haven't received all the guidance they needed to receive. There may be travelers who were not clear on the guidance that they needed to receive. There may be travelers who are a little confused about the guidance they needed to receive. DPH is in the process, as I said, of contacting and monitoring all of these travelers who have been released to go home and asked to social distance. Right? There was a large influx of travelers initially. We are catching up on all of the contacts. So this is why I say this. So what if one of these students actually ends up coming to school? I've gotten some calls, a few, where the school has asked me, is this student, I'm not sure if this student should be here. The student was, the family said they traveled and they brought the student to school. So let's look at that. So these are asymptomatic students, right? They have no symptoms. Any risk of transmission is low. The school can and has called the public health department for recommendations, right? I've gotten those calls, I've answered those calls, and I've responded to those calls, right? The student can be, kept separate at that point. The student can be removed from class if they've entered class. I don't know that they have. I think that I've gotten calls from school nurse or others at the school to double check, which is a good idea. That's why we have the call center. That's why we are responding rapidly. So the student can be kept separate. The parents can be contacted. The student can go home. Not, that's the right thing to do, but it's not necessarily urgent, an emergent situation. None of these students, and there's only a few that I'm aware of, none of these students have gotten sick that we know of, and or exposed others to their illness because they haven't been ill. Not aware of any negative consequences as a result of a few students who may have come to school. And the matter can be handled and has been handled and corrected very quickly without any significant incident or stress. And as I say, I think as time moves on, we're catching up and getting in touch with all the families that need to be contacted and to make sure they understand, what the guidance is. And in virtually all cases I'm aware of, people are very cooperative once they understand what the issue is and once they understand what the guidance is. Nobody wants to, cause transmission or infection if it could be at all avoided. So that's actually what we've been doing working with schools. We've also been updating schools regularly with approximately once a week telebriefings from our leadership. Those invitations are sent out to all school districts, all school officials at every level. And we've gotten a lot of good turnout for our telebriefings to give updated information. So we're working very closely. This is understandably, a fearful situation, but I think needs to be placed in context. There is one case, Dr. Tershita said, there's very few cases in the U.S. and only one case that's been identified at this point in time in Los Angeles County in a traveler from China, from Wuhan, China. No LA County resident has been a case. There's been no community transmission between people in Los Angeles County. That's the situation at the moment. So overall, the risk of transmission of coronavirus in Los Angeles County and across the nation remains very low. And I think we do need to put that while being cautious and taking proper precautions. Because this is a very serious illness, of course, in terms of we see what's going on in China. But I think we do need to put it in context. We mentioned, again, that the presentation mentioned influenza, this is flu season, and I looked up some statistics just for comparison, just to keep in mind. These are from the CDC. I looked them up on the website today. In the first few months of influenza season this year, they're estimated to be 20 to 30 million flu illnesses across the United States. There have been about 200,000 hospitalizations due to flu across the United States. There have been about 20,000 deaths due to flu across the United States. So we do need to be cautious and we do need to take preventive measures to make sure that we stay healthy and our families stay healthy and our students stay healthy. But let's remember what the biggest threat is at this point. So I hope you've all gotten your flu shots. And you still can get a flu shot, there's still time if you haven't done that. So I'm going to leave it at that. I hope I've answered a lot of the questions that have been on people's minds, but we'll have plenty of time to respond afterward, and look forward to that. Thank you very much.
Question is, what if someone who is not keeping social
So the
distance?
answer to how we follow up depends. It depends on the person we're following. And so there's no one answer. But if a person is someone we advise to social distance and stay at home, we are the ones who are following up with them. We have public health nurses, we have investigators who follow up with them. I think the important message here is that we are not asking you to police them. We are not asking you to tell on them, or we're not asking you to arrest them or something. We are following them, and if you have concerns, you can call us. If they have concerns, they can call us, and we will work on it on a case-by-case basis.
I just wanted to add, that's a perfect answer, I think, but I just wanted to add that my experience thus far has been quite the opposite. Again, any time that it seems we may have discovered someone through, just through talking with school officials who may have gone out, it's probably because they really didn't know what they were supposed to be doing. And as soon as they get the proper guidance, they cooperate. Because after all, who wants to hurt their neighbors? Who wants to spoil their neighbors? No one.
I'm going to use the terms schools, both districts, because I think there's people from both districts here. So are there any students or staff from either of our districts that are currently being quarantined or in self-isolation? And are any of them in the retrospective category?
Just yes or no. Don't need names.
Well, I think from the Department of Public Health's perspective, our general response is we don't disclose that information. That's confidential information, but we do want you to have confidence that whoever needs to be socially distanced is being socially distanced. But we don't share details. We protect your privacy as we would protect anyone's.
Thank you, but I can reiterate what you've said. We've had many families, I believe in both districts, who contacted us and said we travel, and our staff has worked with them to confirm, are they required to be in social distancing? And we've had many families, Dr. Gilchet, just like you said, that called and said, we just got back from China, we're going to stay home. So in terms of quarantine, we wouldn't know. In terms of required self-isolation, we wouldn't know because you don't inform us of that. But families are coming and wanting to make sure they're doing the right thing. So we are hearing from families.
It is.
I'm going to go with the answer. So the word is when, okay? So when the virus is detected in our schools, will the district will the district sanitize doorknobs, desks, and other common areas, and how often? I think I can speak for Alhambra School District. We have implemented a sanitization process already. We are wiping down on a regular basis the high touch points like doorknobs and hard surface areas. We are currently doing that. I'm going to change the word here that was when to if there is a case detected. We certainly will take all of the steps that are directed to us by Department of Public Health. But today we have a wipe down practice in place. Our custodians are implementing that now, and we've got it on all those high touch point areas. The question is, don't be specific, say specifically what, don't be general, say specifically what you will do. And I think Dr. Gilchuk, I think I heard you said you will call us if there is a case, and you will guide us at that moment on information to get out and or next steps that should be taken. Second part to that question is, why can't you implement the plan now? For example, aggressive hand washing, mandatory, etc. We are in Alhambra educating our students, asking them to wash their hands. In places that we do not have water, there are some classrooms, most have running water and soap, but there are some classrooms, maybe bungalows, that don't have running water. We are working to put hand sanitizer in those places. Our teachers, our nurses are reminding our students of hand washing. So we are educating our students in that. Some of our primary classes, you will see the teachers line the kids up and say, okay, everybody, we're going to lunch, wash your hands. Very common practice, lining everyone up and saying, we just got back from recess, wash your hands. Susan, is there anything that you'd like to add to that?
It's just remembering that any opportunity that we have to remind people, to remind our children about good practices, again, not only protects us against coronavirus, but also protects us against other viruses and illnesses that are circulating, such as the flu or colds.
And one I got several times. Under what conditions will you shut down schools? What would
That's a
trigger a
hard
shutdown
question.
of a school because of coronavirus?
That's a great question. Our plans build on the number of cases and the numbers that have been impacted. So as Dr. Gilchick said, what we would do immediately at the point that there's one case is notify the school, work to identify who that person may have been in close contact with and exposed, and follow those students. At this point, there isn't a reason why we would consider closing a school, but we would work through each of those scenarios and study what's going on and understand what the risks are and work through it with the school district as we process through the situation. Dr. Tershika, do you feel like from all the other experiences of all our other outbreaks, from tuberculosis to many, many other things, we've never been in a situation where we haven't been able to contain it quickly enough to prevent it from spreading? Yeah, this is a very good question, and I think we've gotten it from our community partners a number of times. It's hard, and it depends, because we have to balance our kids and our students and them learning and them not being fearful with potentially getting a very severe disease. So there's a lot of factors that depend. And we are future planning for different scenarios depending on what may happen with this novel coronavirus. We don't know, none of us have a crystal ball to look into, but we have some plans. Again, we talked about our single case. We talked about maybe a few more cases.
Nothing you
What
can
we'll
say to
do.
this question at this
I
time.
think the most
To
important
be
thing for everyone to know is that we will be
fair.
working with our
What
partners,
can they say?
including your,
What they're saying is that we're
the
developing
education
plans.
partners, schools, your principals, your superintendents, your teachers,
Because I don't expect that we're-
to make
what
sure that we
condition
are all
should this
safe.
But
And
I
it
wanna
would just
make sure
depend on what the situation is, how
know
severe the
how to
illness
do
is,
it.
how many
Shut the
people are
time
getting
out.
it, that sort of thing.
I would also just like to emphasize again that if you hear something or say, oh, I heard there's an outbreak, please make sure you verify with the school, with public health.
I'll take that question because it's most asked question. Exactly, it is the most
Face
asked
mask
question.
question.
And as I look across the audience, I don't actually see anyone in masks, so that's good because we do not recommend general public wear masks. And this is based on many, many reasons, but probably the most important to remember is that when you wear a mask, and you wear it for a long period of time, it actually gets very contaminated and very dirty. Because of your breath, it gets wet, and it can actually become a conductor of virus. It can make you more susceptible to viruses and bacteria because you touch it, you move it to eat something or to drink something, you're touching your face, and that's exactly what you don't want to do. You don't want to touch your face, you don't want to touch your eyes or your mouth because that's how you get sick. So masks are important for very specific purposes, and they're they're made for healthcare workers, for example, because it protects them and you when you're a patient in very specific circumstances. Usually, a healthcare worker will wear it very briefly, or you might be in the doctor's office and you put it on really briefly, you throw it away, one-time use, that's it. It's just if you look around at people who are wearing it in our communities, they're not doing that. They're wearing it for 8 hours. Sometimes people are wearing the same mask for days. It's not hygienic. We don't recommend it. If you have any questions, you can ask us further. Thank you.
The only so may provide maybe a false sense of security, and then the
things that really do protect you from infection, the person who's wearing the mask may not be practicing the hand washing, be avoiding touching the face, you know. So for a number of reasons, we don't recommend it.
Thank you.
Or requiring mandatory quarantine for people entering from China. What makes the district believe that similar measures are not necessary to protect kids in school who are sharing a confined area with kids who literally got off an airplane from China? So that's the first part of that question. What I can share is what was shared earlier by Department of Public Health, is that families who come back to China, who came back from China after February 3rd, we are implementing the best practices and recommendations from Department of Public Health, and those families are practicing social isolation by staying home and meeting the criteria of 14 days from the time they left China. Is there anybody want to add to that? Okay. The next part of the question is, how do you expect parents to remain calm knowing that there are kids in their child's classroom returning from China with 0 quarantine time, while being told about the risk of virus spreading from China? So again, we are trying to provide factual and accurate information to our families and our students. As you've heard this evening from the Department of Public Health, there's only one case in LA County. We have not been informed that there is any danger or threat to our students or staff in our schools, as there has not been any report of any active cases of the coronavirus. So we are trying to be calm and factual and provide education and implement all the preventative strategies that we've shared with you this evening to help kids and staff feel safe and to keep everyone from getting ill from any contagious disease. Anything you want to add to that?
Can I add one piece to that? And that is that at the LA County Office of Education, what we're doing is replicating exactly what these 2 districts are doing to the 80 other districts in LA County. And that goes all the way from Antelope Valley, San Pedro, the mountain area, Pomona. We're making sure that they're following the same procedures that these 2 districts are doing, that we're in communication with the Department of Public Health, and that we're making sure that we're following those procedures, because we don't live in a vacuum, right? We live in a larger global community, so it's important for everybody in LA County and beyond to practice those procedures.
Dr. Gilchuk, I'm going to share something you said to me on the phone a few days ago. I don't know if you remember. But I asked Dr. Gilchuk a similar question, and he said, Denise, we've known about this for a few weeks now, and how many cases have come into the county? And I said 0, since that conversation. There was the one at the airport, but none have made it into the county. So he said our border practices are being implemented. And so we're not saying it'll never happen, but that put that into perspective for me as well. So thank you for sharing that. There are many questions in the same theme, but there's a couple that are a little different. So I think we'll answer those for the sake of time. Are there any DIY formulas that you might recommend for hand sanitizer in case hand wipes, one classroom is using hand wipes? Do you recommend those?
Yeah, I would say the same thing. Look at the label, make sure it's 60% or higher alcohol.
And you are correct, it is difficult to get hand sanitizer. We've experienced that with our ordering as well. This might be a Susan China's question. There's a lot of coughs and sneezes in all the different classrooms. How can schools, students or school can school go up to a student and say, you're coughing, we need to go home?
I sent this question to our lawyers.
We want to look at what their symptoms are. So if we have a student in the classroom who's coughing, who's not feeling well, then we would ask them, send them to the health office. We're not going to say, oh, you need to go home. We're going to say, come to the health office and let's check them out. Do they have a fever? Are they having any respiratory difficulty breathing? Again, are they coughing? Because sometimes we do once in a while have kids that will cough and then they come to the health office and they're perfectly fine. They're socializing, they don't look sick. And those are the ones we're going to send back to class. But if they are sick, they do have a fever, like with any illness, then we're going to ask, the health office staff is going to call home and say, please come pick up your child, make sure they stay home, fever-free for 24 hours before they return to school.
Thank you. If classmates are sneezing or coughing, should we call the school and give the names of those children?
So again, we're really looking at, and I tell kids, if you're sick, we're going to stay home. But just like with you at work, if you have a fever, hopefully you're staying home. But if you have a sneeze or a cough, no fever, and you're still generally feeling okay, you might probably be going to work, and the same thing with children. So that's where part of our practices of using a tissue, immediately throwing it away and washing your hands, or sneezing or coughing into your sleep. Those are good sneezing and coughing healthy practices that we want to implement. So just because someone simply sneezes or coughs is not an automatic reason to send home. We're going to look at, okay, let's check them out a little bit more thoroughly in the health office and see what we find. And then based on what we find, in particular fever, then we will recommend them to stay home. But if we start sending kids home for a sneeze or a cough, guess what? They're all going to catch on, and they're all going to start sneezing and coughing as well. So we want to be safe, but we don't want to be fearful. We want to be safe in going based on what we see in the children.
Thank you. A couple next, N95, ASTM level 3. And where can we buy them? Everywhere in the San Gabriel Valley is sold out.
Well, that's hard to answer after I just said don't wear a mask. But, I mean, first of all, an N95 mask, it's very specific for healthcare providers. It's for airborne transmission. You have to be fit tested. So if you're not fit tested, if you haven't been tested for this, you should never wear one. Plus, if you've ever worn one properly, it's really hard to breathe. You can't be in one all day without passing out. So a respirator is very hard. Don't get those. A lot of people are wearing surgical masks. Those are the type you can buy at like CVS or like a drugstore. Again, we don't recommend you wear them, but what's commonly being worn is a surgical mask.
Okay, 2 more, and then actually 3, and then we will. Thank you for agreeing. Does the coronavirus spread only during the time when the infected person shows symptoms, or could it spread during the time prior when the person is asymptomatic? And that would then beg the second question.
Well, that's like the $1 million question. Everyone wants to know this, and we're not sure. There were some early reports that were reported in the New England Journal of Medicine that suggested a single incidence of possible asymptomatic spread. But that article in the New England Journal of Medicine has since been disproven. They re-interviewed the original case, and she actually indeed had symptoms when she exposed the other people who got novel coronavirus. So right now, we think it's only symptomatic people who can spread the disease. Now, I'm not going to give you a 100% guarantee on that, because there's so much that's unknown about this disease. But based on other coronaviruses, and based on what we've seen so far, it's really symptomatic people who can spread the disease. It does not spread when you're asymptomatic.
Okay, so then the question, if a traveler comes in on an airplane, the same plane where someone came in from Hubei, how do airport customs know that the traveler didn't get infected while they're on the plane with a person coming in from Hubei?
Well, Hubei province has been sort of shut down for some time, for several weeks. So there's been no travel in or out of Hubei. So it's really, you wouldn't have travelers from Hubei province and also from other parts of mainland China on the same plane. That's actually the answer. So, there was I think some, well-publicized flights of, U.S. nationals who understandably wanted to leave Wuhan and Hubei and were transported back to the United States. And as I mentioned, they were all put into quarantine because they had the highest risk of having an actual exposure, right? They were all well, but they may have been exposed to cases, so they were put into quarantine and being closely monitored. People from outside Hubei province, again, have a different risk profile. Of course, there are other places, other cities, other provinces in China that have quite a few cases, but nothing like what's in Wuhan and Hubei province at this point in time. So those people are not considered as high risk, and that's why if they are otherwise symptom-free and well, they are allowed to go to their final destination, which might not be LA, right? You can go from LAX to all over the country, to other places. But for those whose final destination is Los Angeles County, they're given, the instructions to please, stay at home, avoid crowds. That's, social distancing, we're calling it. Don't go to school, don't go to work, and monitor your health. Check your temperature, monitor yourself for any other symptoms. So it's a good question, but it shouldn't happen because those are different travel routes from out of Wuhan or Hubei province versus the rest of mainland China.
If I can speak from recommendations by the Department of Public Health, and if there is confusion, we are calling the Department of Public Health to help the families have the accurate information. So we are doing that at our end, and we'll continue doing that.
She's talking about the school proactively talk to kids returning school from long absence, finding out where they've been.
One of them, and then there were recommendations. Why do health authorities always compare COVID-19 versus influenza when there's a vaccine for one and not a vaccine for the other? How is this reference valid?
So that's a good question. I mean, these are different illnesses, different viruses. But I think the reason that there's a lot of comparison going on is because these are both respiratory viruses that are spread in very similar ways and cause very similar symptoms. They have similar mortality rates. In fact, influenza is probably a bit higher, at least the mortality rate that we know so far. So they're similar in a lot of ways. But yes, there are some differences. One is there's no vaccine for novel coronavirus, although they are working on one. And there's no treatments for novel coronavirus, although they are working on that.
Okay, and then there were a couple comments, and I'll take that comment, and it was,